In Singapore, currently the healthcare ecosystem is pressed by many challenges, such as an aging population, rising healthcare costs, and the rise in chronic diseases.
So regulatory access is one of the biggest challenges.
Increasing demand and expectation of high quality, increasing costs, and decreasing manpower.
Which brings up the question, what does the future of healthcare look like?
I'm Dr. Ngiam Yuan, endocrine surgeon by training, as well as the Group Chief Technology Officer at the National University Health System in Singapore.
I'm Nicolas, Health and MedTech Market Lead at Zühlke.
Hi, my name is Fritz Maier, Managing Director of Erbe Singapore.
NUHS is a premier academic medical center in Singapore, and the goal is to improve patients' lives through innovation and efficiency and care for our patients. We not just want to provide the best care for our patients, but want to provide innovative therapies that pushes the boundaries of science and technology. AI and machine learning is centerpiece of NUHS's strategy to use innovation and technology to improve our patients' lives. We have invested in AI and data for the last 6 to 7 years, and we are starting to see the fruits of this investment. At this point, NUHS primary concern is to ensure that healthcare costs are sustainable. If you then distill that problem of sustainable healthcare financing, it is about improving efficiency, it's about reducing waste, it's about, of course, maintaining or improving quality to meet the increasing demands of our patients. Again, to do all of that, it's not about hiring more manpower, it's not about having more resources. It's really about the clever use of data and technology to enable us to do more work, more quality work, with the same amount of resources.
Erbe is a family company founded more than 150 years ago. Our vision is to collaborate with doctors and healthcare institutions to improve patient care and to enable treatments of diseases earlier. We believe that digitalization will revolutionize healthcare, just like many other areas. With the help of data, surgeons will be able to perform their procedures even better.
We help our clients solve complex challenges through innovation and technology. We work with a number of players in the healthcare ecosystem, which is quite broad, such as MedTech startups, hospitals, pharma companies, and medical device companies such as Erbe. We work with a lot of healthcare and MedTech startups in Singapore on product development initiatives. We also work with the larger medical device companies. So for instance, we're working with Erbe in the areas of digital and data in a mobile app. We have also worked with public healthcare institutions such as HSA and NDCS here in Singapore, using tools like AI and digital to build tools that improve the lives of clinicians and make the lives of patients also a little bit easier.
We collaborate closely with healthcare institutions, doctors and nurses. We find out what is their needs in terms of training, and we use our technology to enable experiential learning coupled with theoretical trainings in this location. Naturally, our neighbor NUHS is one of the partners that we collaborate very closely with. In order to be able to better innovate in the digital field, we often choose to collaborate with partners. Collaborating with Zühlke allows us to harness the data that is generated during the procedure, but also to embark on projects, what we can do with this data and how we make use of it to enable surgeons to operate more efficiently, but also for ourselves to manage our product lifecycle, and lastly, for new business models.
So with Erbe, we are looking at the topic of connected devices in a healthcare ecosystem. So what that means is we look at how data not just stays within a device, but that how can it connect with other elements, say in a hospital or say in a healthcare ecosystem space. And with technologies such as IoT, data and AI, this is definitely a topic that a lot of medical device companies should be very interested in. This will enable them to do surgeries with different procedures. This will allow them to learn about different Erbe functions in the device that they might have not known of. And this will allow them overall to improve how they do surgeries, whether that's a higher quality procedure or a faster, more efficient procedure. And moving forward, how we see this growing is that we look at the possibility of how the data not just stays in the app, but how the data can inform other business units or departments in Erbe, how training programs are designed for clinicians, and how it can influence product development using data that is collected real time with real users.
We have benefited a lot from public-private relationships, and we have benefited from the technologies and the innovations that come from the private sector. At many levels, we adopt technology, so be it at the device level all the way to AI technology. We have had a very strong working relationship with Erbe, not just on the medical technology front, but also on areas of data. We are keen to work with Erbe to see how some of the data that is made available to practitioners like myself can be meaningfully used to improve our practice. We are really looking forward to not just working with industry, but we want to adopt more of that technology.
The healthcare landscape now has a lot of access to different technologies like AI, digital, software engineering, as well as IoT and AR and VR. And I think the question for a lot of health companies would be how to leverage these technologies. Not so much about the access and what to use, but how to approach it in this complex world where there's a lot of regulatory challenges, but you have patient safety at the forefront of clinicians' mind. That's how Zühlke partners with different companies to navigate this landscape. I think with aging population and rising healthcare costs, there's definitely potential for AI, data and software to look at what are the emerging trends and how we can predict different trends early. Nowadays, we realize that innovation can only go so far in one organization, and it's about partnering with the right partners and the right stakeholders and the courageous stakeholders that can take an idea from a concept to something that can be fully implemented.
We are fortunate that in a country like Singapore, it is quite pro-innovation, and there are actually pathways for new innovations which allow regulatory clearance earlier, especially in the collaboration with healthcare institutions.
I think staying relevant in the healthcare ecosystem takes a lot of continuous innovation, continuous collaborative partnership with different members of the healthcare ecosystem.
Technology will change our lives in a very transformational way, specifically the use of data and how we employ AI. You have to adopt this technology, you have to embrace it and to use it to the best of your abilities.
Ultimately, our aim is to help patients to live better, and therefore it is always about how can our technology be used to improve patient lives.